thank you to SASA for the invitation to be here this evening to share with you some of our thoughts on primary healthcare from the ANC perspective, and also I think to engage in something which is always extremely valuable, and it's even more valuable at this stage of where our country is at the moment, and that is dialogue between concerned members of not only the public but people like you who in a sense carry the responsibility of implementing further policies in the future. So in a real sense, it's not the people up here who are the important ones. I mean, we can make policy until the cows come home. But the important thing is what's going to be done with it. How is it going to be implemented? And this is particularly true of primary healthcare, which is the first level of interaction between the people, the communities, individuals and communities, and people who are providing services. And quite obviously, the ANC, because we believe that the power must be with the people, the first statement that we would like to make about primary healthcare is precisely that it must be the people who must be able to state their needs and make their demands known to the structures, to the professionals, to the healthcare professionals. It can no longer be a situation where healthcare professionals or government structures impose their will unilaterally and hierarchically on the people. To talk more specifically about the ANC position, at the moment, there is nothing cast in stone, and hopefully that will remain the case. We have statements, we have documents, and we have a position on primary healthcare. And it's embodied for everyone to see, for example, in the booklet Ready to Govern, which is readily available. That sets out our primary positions, and we are not going to change that very much. What we're busy doing is fleshing out policy. The other document that is available now is kind of final draft on the proposed structure of the National Health Service. So I will be quoting a little bit from these two documents to give you more specific points of our policy. I said just a minute ago that, in a sense, I hope that we never have a policy. And one of the values of where we are at the moment is anything becomes possible. We're still in a position where we can discuss, where we can work together and create a policy together. And that must be an ongoing process. And in a sense, it's the first aspect of primary healthcare which is necessary, that there must be a continuous dialogue between the people and the professionals and the structures. If we look at the ANC policy guidelines on health, the very first statement that it makes is that it's a question, what do people need to be healthy? And what we go on to say is something which everybody knows, that for people to be healthy, it's necessary that families earn enough money to be able to live decent lives and work under safe conditions. People need decent housing, adequate and safe water, sufficient nourishing food, adequate, decent toilet facilities, appropriate, effective waste disposal, getting rid of rubbish, industrial and human waste in ways that will not damage the environment, and life standards will be improved where people have a reasonable standard of education and opportunities for rest and recreation. And in a sense, once again, that's where primary healthcare is about. It's attaining, helping people to empower themselves and bringing pressure to bear on the structures to bring that into being. So those are the primary principles. I think that one of the major problems that we're going to have to battle against in the future is the current state of health services in South Africa. In spite of what Dr. Vugarellis has said, I think that the last 40 years of health provision in South Africa, although earmarked by many, many people who have given their lives to their fellow people as health professionals and with lots of goodwill, nevertheless, there has been this dreadful fragmentation of health services, which still tends to persist. There has been a total inequality of health services. And what's even more worrying at the moment, of course, is the fact that it would appear that the government is still fragmenting, privatizing, and in a sense talking the language of primary health care without actually implementing it in a really meaningful way. Now, if we go on just a little bit further about principles of ANC health policy, once again, obviously it's based on the World Health Organization documents which spell that out, and also obviously the aspirations of our people which are enshrined in the Freedom Charter. And the first description of primary health care is right at the beginning of our principles, and that is that primary health care approach is essentially one of community development. It aims to reduce inequalities in access to health services, promotes equitable distribution based on appropriate technology, and integrates the many sectors of modern life, such as education and housing. Further, it is based on full community participation. If the ANC is not able to do that in the future, then it will have failed. And I think in many ways, once again, in spite of what Dr. Vugarellis has said about the difficulties of community participation, I do believe that it's absolutely vital, and I do believe that it's possible. I think that you know that as well. But that means, once again, that it's the people on the ground, communities, who are going to have to be responsible for implementing primary health care policies. They have to take responsibility, and I'm sure that our communities, our people will be prepared to do that. Further on, the national health system will actively promote community participation in planning, provision, control, and monitoring of all services. The responsibility for healthcare will be coordinated between national, regional, and district authorities. Once again, with primary healthcare being at the core and at the leading edge of all those different levels. It's the foundation on which much of our health policy rests. Without the foundation, the rest of it comes tumbling down. And the first point of contact always will be with community health workers, primary health care workers, operating in the community, who are of the community and responsible to the community. The primary healthcare centres will once again have community participation and effectively control, with dialogue between community and the professionals who might be running it. Within the National Health Service, primary healthcare workers particularly, but all healthcare workers, must respect the rights of the individual, and people must be able to say how they need to have healthcare services made available. That's a very brief summary of the ANC position. I would, before I finish, just like to say that I think that part of the problem that we are going to have to try and overcome together in the future is the fact that primary healthcare and the philosophy which lies behind it, which I've been trying to briefly describe, can only work if there is what is called a paradigm shift, which is happening throughout the world. In many cases, healthcare, as we know it at the moment, is based on the biomedical model, which is a relatively recent, primarily Western invention, if you like. And it's worked very well in many ways, but it has a lot of problem areas. And it's, I think, largely because of the biomedical model being accepted as the health model that throughout the world we're having major problems. All governments throughout the world are having major problems with the whole issue of healthcare. And I'd like to point to two major changes which must occur in this shift in thinking. The first is that the biomedical model, by and large, is not a health model at all. It's an illness model. It's a disease model. It's a prevention of disease model. But it's not about health. So the most important thing that's going to have to occur, a shift in our own thinking which is going to have to occur, is what is health? What are healthy individuals? Who are they? And how do they remain healthy? And what are healthy communities? And how do they remain healthy? Much of the research, I think, that we must do in the future is about health, not about illness. Any of you who have been trained, like myself, as a clinical psychologist, I'm also trained within that biomedical model. And the core course that you do, the central course, is on abnormal behavior. And I think this is crazy. I think this is one of the major problems that we have to change. We have to focus on health and the propagation and the teaching and education of people to take responsibility for their own health. The second problem is that basically the biomedical model is hierarchically structured. In other words, there are heads up there who know, and they tell the people lower down. There's doctors and there's nurses and there's physiotherapists. And underneath is the people who are patients. You know, they in a sense are powerless, they suffer, they've got the disease, and we will tell you what to do. It's also elitist. To get into medical school, for example, you have to have 6 A's, which keeps the elitist process going. It doesn't matter if you're a totally bad healer, if you've got 6 A's, you can get into medical school. And that's also true of clinical psychology. So that elitist element, I think, has got to go. We have to have people who are able to heal, who know about dialoguing with themselves about their own health, and who are able to help on an equal, interactive footing the people amongst whom they're working to achieve levels of